Hi guys, it's your buddy Anders here. Slightly different video today. Firstly, I want to update on the Crag Hoppers Adventure Pole that I did in the last video. Haven't used it as a camera pole yet, but have been using it as a walking stick since yesterday. Because yesterday I had surgery. And this is a bit of an informational video. I'm not claiming to be a medical expert. I was a nurse a long time ago, but my experiences of my condition. So last year I was diagnosed with a umbilical hernia via ultrasound, and it took quite a few months for me to actually get a surgery date for it. Bless the NHS, they work as hard as they can, but you know, it's difficult to get stuff. And it wasn't a major thing. It's been uncomfortable for around about a year. I've had pain in my groin area, which is not fun, and there's a bulge. It's lovely. We won't go into gory details. But yeah, so an inguinal hernia I've got, which is in your stomach. Let's tilt down a bit. So in your stomach, from there to there, you have a long muscle. And down in your groin, that muscle separates like so. And then what happens is part of your intestine, your small bowel, protrudes through and causes a bulge. It can cause pain, it can cause discomfort. It apparently happens to 1 in 4 men in their lifetimes, and 1 in 7 of those men will have to have surgery. Hernias do not go away on their own, they don't resolve by themselves, they're always there. It just depends on the level of discomfort. The risk is when you're older and you're slightly a bit chubbier like me, although I did lose a lot of weight last year, which kind of brought it on. It can cause separation, weakness in the muscles, causes strain, and the worst case you can get what's called a strangulated hernia, which means the bowel protrudes through, the muscle closes over the top of it, and you have to go into hospital urgently. I never got to that stage, thankfully. But so yeah, so flip backwards. A few months ago, diagnosed, ultrasound. Yeah, so yesterday I had surgery. I was looked after by some very nice people at a local hospital. Admitted at 11:30. My actual surgery was just after 5 o'clock, and I'd returned to the ward about 6:30 and discharged by 10 o'clock. So, well, 9:45. I was home by 10 o'clock last night. So it's only a day case, which is good. And basically what they do is it was under a general anaesthetic, which is a weird sensation, I won't lie. They cannula in the hand and they inject you with the stuff, and it feels like your arm's gradually freezing. It's really, really cold. Then you get this weird sensation in your chest for a few seconds, and that was it. I was gone. Nothing. That was it. I woke up about 6:30. Surgery had gone well, and what they basically do is it's a laparoscopic surgery. So they use a little tool and then a little knife, well, a little camera, and do it all inside. And apparently that's the less invasive way of doing it. So yeah, they did that. That took about 45 minutes. And then it took about 45 minutes for me to recover and so on and so forth before I was sent back to the ward. The surgery was a success, which is good. They also found a lipoma, which is a fatty lump. So yeah, so what they do, I'll go back, is they open up and they insert a mesh underneath the abdominal muscle where the intestine is protruding through, and it stops it from protruding through, and it seals up and it stitches the muscle back together. So that's what they actually do to close the hole. So yeah, they go in laparoscopically and do all of that, and then sew you all back together. But yeah, they also found a fatty lump, a lipoma, which is a pre-cancerous liposarcoma. So potentially lipomas, it's a fatty tissue, can eventually lead to being cancerous. This one wasn't, fortunately, but they removed that anyway, so that will hopefully alleviate a lot of the problems. And that was connected around one of the fibrous tubes that goes to your testicles. Yeah, joyful stuff. So Yeah, I woke up and I was fine. I was under a lot of sedation. I was on fentanyl and all sorts of stuff, so I was a bit out of it coming home last night. The drugs do make you disorientated, I will say that. I got home and I was confused, irrational. It's not the most pleasant experience to have. It's almost like you're not in control of your own actions, which is horrible. But I slept it off. Slept on the settee because we have a big pull-out settee. So slept on the settee and it was nice and comfortable. I did get a few hours sleep. And yeah, I'm now dosed up on cocodamol tablets, which is a paracetamol and codeine based one, which is basically metabolised as morphine in the liver. And it's quite a good painkiller. I can't take ibuprofen, I can't take aspirin because they act on me differently and give me a bad stomach. So the surgery went well. No, it's just a case of resting for the next couple of weeks. Which is really difficult because I want to do stuff. I feel I'm in pain and I don't like sitting around, but if I stay sitting around, I get bored and I get tetchy and I want to move around. But if I move around, it kind of gets easier, but then I want to do stuff. It's weird. I mean, like my wife's home today, she's been looking after me and it's brilliant. But I am frustrated with the lack of doing stuff. I did make myself a sandwich earlier, which was good. But yeah, no heavy lifting, no driving for 2 weeks. Potentially further ahead, it may be up to, because there was the extra stuff that they had to do, maybe up to 3 to 4 weeks off, which sucks. Because, you know, I teach, I enjoy teaching. I feel bad for my students that they're going to, you know, have a couple of weeks where they're not going to get the best teaching from me. But, you know, this thing had to be done, it couldn't be put off. It's not like, you know, I'm doing it for shits and giggles and fun. You know, it's a health thing, it's important and needs to be addressed, because for the last year I haven't been able to run, I haven't been able to do Viking reenactments. All I've been able to do is basically walk, no heavy lifting or anything like that for literally a year, and it's been frustrating and it's sucked. So at least now I can get on with my life, which is good. But yeah, a friend of mine, Michael, on Facebook has asked about the experience. He's scared about going in for exactly the same procedure. He's going in for a inguinal hernia repair, and he's been putting it off. So I'm doing this video partly for Michael as well, to say, look, the longer you put it off, the worse it's going to get. Yes, it's scary. It was scary being put under a general anaesthetic, I won't lie. There's always that fear that you're not going to wake up and that kind of stuff. But, you know, I was in brilliant hands. The staff were amazing. I mean, this is day one. Surgery was last night. And I am moving about today. It's painful. You know, it's uncomfortable. But in the long term, it's going to be so much better for my health. So, and for you, Michael, this is what I'm saying. It's going to be, you know, long-term beneficial. And yeah, it's a scary thing, but make sure you've got a support network in place. You know, I'm fortunate that, you know, I've had loads of shout-outs on Facebook and things like that, and people wishing me well wishes, and thank you all so much. It's really, really genuinely meant a lot to me. Loads of messages to getting well soon and stuff, and that kind of support, you know, is fabulous. Make sure you have a support network in place. You know, I think it's going to be, the next few days are going to be weird because my wife's had to go back to work tomorrow. So I've got a couple of days on my own. So I'm just going to sit and binge Netflix and take it easy as much as I can. But yeah, what I will say, for anybody who needs to have a hernia repair, they are scared about it. Of course, any kind of surgery is scary, but it's worth it. In the long run, it is worth it. And Michael, please, you know, if you've got any questions and stuff like that, ask me. I will happily answer as best as I can. And I think I'm going to do a few of these videos as well to sort of show the progression over the next few days of how I'm sort of improving and stuff as well. So I may turn this into a daily vlog, don't know yet. One thing, most men, not all men, most men love stockings, right? Yeah, it's a thing. Pretty lady in stockings, or a pretty man in stockings. Right, so for the next 6 weeks, I have to wear these bad boys. Look at them. They are anti-deep vein thrombosis stockings, compression stockings basically, because I'm going to be relatively immobile compared to my normal. Prevents clots in the legs and stuff like that, so I have to do hourly movements with my feet. I have to give my feet like this, and I have to rotate one like that for 10 seconds, and rotate that one like that, which is a bit difficult because that's my side that I've had the thing on. And then uppy downy, and uppy downy. Yeah, so 6 weeks. I've got to wear those. I mean, at least they're not white. At least they're, yeah. Well, I can wear socks over the front of them. So once I'm even back to work, I've still got to wear these as well. Once I get back to a normal routine and start walking and stuff more, then yes, I don't have to wear them. But when I'm not active, I have to wear the stockings, which is joyful. But yeah, the grossest bit is you're not allowed to have a shower for 48 hours after surgery. So, surgery was yesterday, so I can't have a shower until tomorrow night, and it's like a bit funky when you're a guy, you know. Yeah, I like having showers. I have one, you know, pretty much every day. But I can show you. I'm not going to show you the wound because that's kind of gross, and in obviously a very intimate area. Fair warning for any people who are going in for this: you get shaved, and it's not a neat, lovely shaved jobby. It's a mess. It's like, you know, when you're like mowing the lawn and then you just get bored halfway through and stop and go and have a cup of tea. It's kind of half finished. Yeah, it's like that. It's weird. I won't show you the wound, but I will show you on my stomach. Look at it. That is iodine from where they had the sterile field. It's gross, and I can't wash it off. Yeah, the pain sucks. I can walk. The stick has been amazing. I'm really, really pleased for it. It's nice and sturdy. It will support my weight. Sitting is comfortable-ish. Lying is comfortable-ish. I mean, at the moment, I'm sort of sat with that leg stretched out. So it was a right-sided hernia, which apparently is the most common side as well. And we also drew a little arrow pointing to where it is as well, just in case, you know, for like surgery, I got confused. Yeah, so it's just a matter of, you know, healing up for 2 weeks minimum where I can't drive or do anything, and possibly further. We don't know. I've got to have my wound dressed on Friday. I mean, theoretically, they might take the wound pad off and it'll heal on its own. It's just little mini sutures that dissolve by themselves, which is good. But the pain is variable. It's like, if you're going on a scale of, say, 0 to 10, means 0 there is no pain whatsoever, and 10 is like full-on heart attack, the most excruciatingly broken bone kind of pain. Last night when I got out and I got home, I was probably 6 to 7. Today, with the codeine, I'm settling at a 4 to 5. So, you know, it's present, but it's tolerable. Moving around a bit does help, but then it kind of makes it worse, and the codeine's helping a lot as well, but you can't take too much codeine in a day because it's kind of addictive and stuff. So yeah, but this is the thing. So I'm at a 4 to 5 now, right? On a 0 up to 10. Now, on a normal day, my everyday, literally for the past 6 months, the worst I ever had the pain was when we went to Scotland last summer, in August last year, and that was excruciating, and it was postural more than anything else because I've been driving for, you know, 6 hours in the same position. And that was really, really bad. However, literally on a day-to-day basis, my pain is normally at a 2 to 3 in my groin anyway. There's a constant ache there, no matter what I do, whether I rest, whether I take painkillers. It's always there, it's always present. It literally is a pain in the balls. That's the politest way of putting it. It just feels like pressure. It's like a constant, just pressure and debilitating pain. So, hopefully, I mean, you know, the whole purpose of this is to alleviate the pain. And there are, you know, there are potential side effects. I mean, the side effects that there are is numbness in the area completely. So your nerve endings just get shot off, which is fine. There is more pain from it potentially, in which case you have to go and get all your nerve endings burnt off. There is a 1% risk of testicular dysfunction, sexual dysfunction, And there's also, like, you know, risks of, like, you know, sort of general pain, and all the, yeah, you know, painful having sex for the first few times. And, you know, I'm keeping this real, I'm being honest about it, you know, because we're all adults. Sex is a part of life, and yet apparently sex is quite painful. For statistics which you read online can be anything up to 3 years, yikes. But usually, you know, within the first few weeks of it sort of healing up and stuff, you're able to resume regular activities. So if you're single and stuff, you know, I've got much to worry about. But yeah, so yeah, so there are side effects. I mean, and there are potential risks. As far as I'm aware, nothing went wrong and everything's all hunky-dory down there. But I'll be going to see the consultant in a couple of weeks anyway, just for a review and to make sure everything's all fine and fabulous. At the moment, I mean, everything, touch wood, brains. Yeah, at the moment everything seems okay. I say it's pain, and it is difficult to move around. I mean, if I try and stand up, it does take a while, because first I have to bend my leg. And then, I mean, we never said, I have to use a walking stick or anything after discharge, but I tell you what, this has been brilliant. It's not there to support, well, it's not there to be used as a replacement leg or for anything like that, but it is so useful just in the fact of it just gives me something to grip onto, and it is bloody sturdy as well, so I'm really pleased. But yeah, it just takes a while to move about, but moving about does, you know, they do recommend that you sort of move about and get yourself unstiffened and that. So yeah, so this is day 1 post-surgery, and again a kind of mini review of the Crag Hoppers Adventure Pool, but also an update on life and what it's like to live with a repaired hernia. Yeah. So yeah, I do hope this video has been useful. I'm sorry if this is not everybody's cup of tea, but you know, like I say, somebody on Facebook asked me about it, they're terrified, and I said to them, look, I'll do a vlog about it, I'll talk to you about it, I don't mind. So yeah, on the flip side, I'm off for 2 weeks, so can't do much in the way of creating or doing anything particularly amazing and exciting, but I can do some. I'm going to try and do some crafting stuff, just really lightweight stuff, and I think I might do some more. Do some daily vloggy things, and I might do some mini reviews, because I have. Let's take it with me. I like to collect old cameras. Ignore the mess. I do apologise. And I love old vintage cameras, yes. I love first-gen digital cameras, and I think I've said this before, but I'm a bit of a Sony fanboy. And up there I have, can you focus, some of the very first Sony cameras that take floppy disks, and they're brilliant. I love them. They're terrible. I mean, one's 1.3 megapixel, one's 0.3, and one's 2.1 megapixel. So what I'm going to do is I might do some mini reviews. I might set up a little faux studio and just do some shots of them and see what we can do, have a play. But yeah, I've also got some footage to put together from me and daughter went to London last week, because I knew I wouldn't have much chance to do anything else anytime soon with her. So we went to London. It was a brilliant day out. We went to, where did we go? Everywhere. Forbidden Planet. Oh yeah, I showed you in the one video some of the comics that I got. I think that was in my last video. Yeah, we got some comics, we got some other stuff. It was brilliant. It was a nice day out. It was good to be able to spend some time with my daughter, and her buddy Marco came along. He's an awesome, cool kid. So yeah, it's a good day out. Right, so I've been waffling for 20 minutes. I'm going to go. Again, I'm probably going to do a video once a day this next week. Do a daily vlog, let you know I'm getting on. Hopefully you'll see some improvements with me. Hopefully I'll feel better from all of this, but we'll see. But yeah, I'll bring you along the way. So, if you've liked this video, if you found it useful, click the thumbs up, comment below, send me well wishes, you know, that'd be lovely. Like, comment, subscribe, share, do all of that wonderful stuff. And yeah, if it is useful to you, and again with these kind of videos, you know, if it's useful just to one person and one person finds something beneficial from the review stuff or from the blogging stuff or from, you know, general stuff, then it's worth it for me. You know, I've spent 20 minutes talking, which I'm good at talking. So, yeah. But yeah, like I say, this one's for you, Michael. I do hope it helps. And that's it. Right, thanks for watching. Toodaloo. I'll get this video uploaded shortly. It's going to be a bit of a delay. Maybe like this will come out later. And yeah, and so on. But yeah, that's it. Bye bye. I'm going to go. If I can stop the record button. There we go.